This is Debbie Bucher with Parkland College, and this is for the LPN to RN Transitions course. And today we're going to be looking at Chapter 13 from Laura Claywell's book. And the Chapter 13 is with regards to the care and safety standards, competence, and nurse accountability. Now, as you complete your RN educational program, you are expected to be capable of safely managing the care of a variety of patients. Knowledge and skill acquisition are lifelong endeavors for providing growth to you. And you need to recognize your role in the continuation of knowledge and skill acquisition. You always want to be reflecting on your practice and seeing areas maybe where you need to make improvements or making changes to best help you meet the patient's best outcomes. And as a nurse, you want to continue to acquire knowledge and experience to advance in nursing and ways to maintain accountability for professional and personal development and how to maintain personal motivation and self-esteem. Pat Benner in 1984, she came up with the classification of the nursing skill using these levels. The first one is novice. This is where you will be as you graduate with your RN from Parkland or wherever you're graduating from. Beginner has beginning skills, lacks experience, and does exactly as told. So not as much critical thinking skills. Advanced beginner, you're gaining experience in the field and demonstrating a solid performance, level that most graduates are in. Competent nurse is usually 2 to 3 years in the new role, and you're able to develop safe organizational skills to get through the day's task efficiently. And again, a novice nurse will eventually become an expert. At the beginning, a novice nurse is just a beginner with the beginner skills, usually a concrete thinker, and believes whomever has authority over them. Now, a more competent nurse has some nursing experience and is deemed to be safe and efficient. And as the nurse gains experience, you gain expertise and knowledge and improve your critical thinking skills. Now, all the while, no matter where you are, we all have accountability as nurses. We are all answerable for our actions and interventions, and we take responsibility for our actions. The standards of practice and standards of care help to guide our practice and define benchmarks for judging nursing care. We also have the state boards of nursing, which help to define the scope of practice for nurses in each state, and there are also state and national nursing organizations that help to define policy and position statements about the standards of care. Quality of care includes caring, which is a characteristic the nurse displays through compassionate care of the patient while still striving for good quality, but with compassion, which is important. Now, a proficient nurse has more experience, has beginning ability to recognize patterns and think both holistically and critically, and then the expert nurse has a great deal of experience and is flexible, adaptable, and is able to respond to changes with ease. And now looking at educational and professional standards, it is likely that in your practice as an LPN, you have encountered changes within the healthcare system and in response to the 1999 Institute of Medicine report, and it's called To Err is Human. And in this publication, the IOM identified that more people die in hospitals every year from preventable errors than from motor vehicle accidents, breast cancer, and AIDS combined. That's pretty huge. So think about that for a moment. The IOM identified the areas within the highest rate of errors to be in ICUs, ORs, and emergency departments. Since then, major healthcare quality organizations have stepped up to address this astounding issue. The Agency for Healthcare Research and Quality called for the creation of a culture of safety or a commitment on both individual and organizational levels to accept accountability to attain excellence in performance by directing resources to the problems. There's also the National Quality Forum, which has created a list of never events categorized into 6 different areas. They are surgical events, product or device events, patient protection events, care management events, environmental events, and lastly, criminal events. So just consider this for a moment, and who is the one that's going to be most likely to hopefully make a difference in any of these areas? Well, you probably as the RN, because you will be front and center in the middle of this battle to protect your patients while in your care. And as nurses, we need to have professional accountability. We need to be answerable for the actions or interventions one performs as a nurse. We need to take responsibility for our professional growth. And also, we need to be accountable to the patient, society, and the profession. There are benchmarks for judging nursing care, such as standards of practice, and there are individual state boards of nursing that define the scope of practice and licensure requirements for each particular state. There are also standards of care at the state and national nursing organizations and specialty organizations who establish policies and provide position statements. So you might want to take some time out to go on your computer and find the Illinois or whatever state you're in the nurse practice at, and just see exactly how it defines our role as nurses. You can also visit the Illinois Center for Nursing website to view resources that are available there. And the AMA has a policy statement about the need for the RN to use the nursing process when making plans of cares. And educational and professional standards, they are practice policies and standards that establish limits and benchmark the graduate's ability to give safe and effective care, but professional accountability and the burden of proof for one's individual competence falls to the graduate. Personal accountability, the new graduate should make an honest assessment of weaknesses and strengths related to the chosen work area so you can carry out a plan to address them. So again, personal accountability, the RN should maintain current level of expertise by attending continued education and competency updates. The new graduate should make honest assessment of weaknesses and strengths related to the chosen work area and carry out a plan to address them. Now, sometimes it can be overwhelming for a beginner nurse as much trust is placed to them because remember, we are caring for people and their lives, so we take that very seriously. So the nurse needs to make sure that they are reviewing policy and standards of care to help guide practice, but ultimately the nurse is responsible for the care that they give. This requires extensive learning for the new nurse. All nurses have to maintain a level of expertise defined by the ANA and the National League of Nursing's. We have to have 20 hours of continuing education now as an RN every 2 years. If you do not, then you may not be able to maintain your nursing licensure. The new nurse should schedule monthly meetings to go over where they are and if goals are being met in order to be proactive in making sure that you are meeting this intent. Very, very important. If you don't, then you will not get your license renewed. So there are again professional practice standards and standards of care. We use the nursing process to help plan our care, and we use the professional and special organizations to set policies and practice standards, identify what the prudent RN should do, also state accountability and autonomy are practice standards. Clinical judgment shows accountability. Collaborate with the healthcare team, and also looking at the American Nurses Association Code of Ethics, which is the fundamental ethical standard for nursing practice. Very important that we follow and are cognizant of that. We also need to have professional practice standards and standards of care. RN uses the nursing process to plan care. RN also should belong to professional and specialty organizations that help set policies and practice standards. And remember again, you need to identify what the prudent RN would do in any particular situation, and accountability and autonomy are practice standards. Clinical judgment shows accountability. You are able to collaborate with the healthcare team. And then the ANA has a code of ethics, which is the fundamental ethical standard for nursing practice that you might want to familiarize yourself with that as well. And again, each state has a Nurse Practice Act, so you need to be responsible for whichever state you're practicing in that helps set legal boundaries for nurses. And again, just remember that there is professional accountability involving you as an RN. Question: which organization agency is responsible for defining the standards of practice? Answer 3, the individual nursing state boards of nursing. So yes, which we've already talked about. So different situations, a healthcare team member may defer or avoid asking for assistance from a supervisor to resolve a problem or report an error for fear that it will hurt his or her professional reputation. The RN must act judiciously and prudently in the delivery of care. By not going to the supervisor when a mistake is made and failing to demonstrate accountability for contributing to the mistake, the RN risks not only harm to the patient, but also potential legal and ethical consequences. So even though you've made a mistake, you need to come clean with it and be honest. Number one, because you want to be able to provide the best care for that patient depending on what it is that happened and occurred. So this is very, very important, and this is an area where you are able to take accountability. And occurrence reports or managing care aberrances, the RN directly involved in the error or who discovers the error completes the occurrence report. You need to document errors in omission or commission and measures taken to safeguard the patient. You need to take a positive step to improve quality care. And then you'll look at root cause analysis, identify what the underlying cause was, and there should be a designee to seek errors of process rather than lay blame on individuals or groups. And again, with root cause analysis, it helps to identify the underlying cause and to seek errors of process rather than blame others. Most errors are from a break in a chain of events, so you always want to look at that to see, okay, if we did break a chain of event, could this have caused this complication? So involving management and decision making, accountability also extends to times when the nurse must involve supervisors, department managers, or the nursing or hospital administration in the decision making process. There will be times when management is needed to facilitate care or to assist in operational decisions. So following the chain of command, the nurse first identifies problems by first notifying the immediate supervisor and works up the chain of command if needed to resolve the problem. Communication problems can occur between the nurse and physician, and if not taken care of, can compromise the care of a patient. Involving management in decision making, accountability also extends to times when the nurse does indeed need to involve supervisors, department managers, or the nursing or hospital administrators in the decision making process. There will be times when management is needed to facilitate care or to assist in operational decisions. So again, you need to follow the chain of command, and as the nurse, identify problems by first notifying the immediate supervisor, and you work up the chain of command, and if needed, to resolve the problem. Communication problems can occur between nurse and physician, and if not taken care of, can compromise the care of the patient. And also managing complaints from the patient and family, determine whether assistance is needed to address the pattern, make referrals when needed, follow the chain of command. This resolves problems by beginning with the immediate supervisor and, if necessary, working up the chain of command to higher levels of authority, even to the agency board if needed. Question physician's orders if necessary, particularly if you don't understand an order or you're thinking that maybe it's too much of the drug or not enough of the drug. You certainly want to bring that to the care provider's attention so that they can make the needed changes. And there's also the quality of care measurement, where you gauge patient satisfaction, cost of care, and effectiveness of care. Patient satisfaction increases with nurses listening, empathy, and understanding. Patient satisfaction decreases when nurses are detached, all business, or seemingly uncaring. RNs must pay attention to quality care ratings. RNs are accountable to ensure that patients and families are satisfied with the care that they receive. Another quality of care measurement, gauge the patient satisfaction, cost of care, and effectiveness of care. Look at patient satisfaction increases with nurses listening, empathy, and understanding. Patient satisfaction decreases when nurses are detached, all business, or I think I've already said this, I apologize. RNs must pay attention to quality care ratings, and RNs are accountable to ensure that patients and families are satisfied with the care that they receive, which is very important. So being accountable, using the care and safety standards, competence, all lead to good nurse accountability. So this now concludes the lecture on Chapter 13 in the LPN to RN Transitions book by Laura Claywell. Thank you.